Welcome to INAN's Student. INAN Student is a platform for law students to come here and deliver a lecture on the topic of their choice. Today we have with us law student Pratham Patel. He is going to speak on role of NGOs and civil society in drug awareness and prevention under the NDPS Act. He is from KES Sri Jayantilal H. Patel College of Law. So without wasting further time, I would request Pratham to commence with his lecture. Thank you.
Good morning, everyone. Let's start with the topic. Drug abuse is a serious and widespread problem that poses significant challenges globally affecting individuals and communities. Despite awareness, the harm caused by drugs usage continues, leading to worse physical and mental health and psychological issues such as depression, anxiety, and irritability. The lives of drugs abusers are often spoiled in all aspects, including academic, performance, social relationships, and self esteem, costly treatments, and rehabilitation. The NDPS Act of India 1985 aims to address these issues, but to make it successful, support of NGOs, non-governmental and organizations and civil society is very important for its success. These groups play a vital role in drug awareness and prevention through education and advocacy. Their local efforts support governmental programs, encourage people to get involved, and create a team approach to fight drug abuse. Narcotics, Drug and Psychotropic Substance Act 1985 was enacted to combat drug abuse and to regulate the use, distribution, manufacture and trade of narcotic drugs and psychotropic substance. Narcotic drugs induce the sleep, but a psychotropic substance affect the minds. This act aims to control the manufacturing, possession, sale and transportation of narcotic and psychotropic substance. It specifically bans 200 psychotropic substances for walk-in customers requiring prescriptions for their purchase. The role of NGOs and civil society in drug awareness and prevention is pivotal, especially under the framework of NDPS Act 1985. These organizations serve as important links between the government and the community, using their local reach to educate the people, prevent drug abuse, and reduce its impact. Through various programs and initiatives, NGO and civil society help reduce the drug abuse. Common drugs on abuse, which are easily available, that are ganja, opium, morphine, heroin, cocaine, methamphetamine, MDMA, etc. Let's see about the effects of drugs. There are three effects of drugs: stimulant effects, depressant effects, and hallucinogenic effects. So first one, stimulant effects. Stimulant drugs like cocaine and methamphetamine make you feel very awake and change your mind. They can cause feelings of anger, panic, and even thoughts of hurting yourself or others. Using a lot can lead to needing more to feel the same effects and strong cravings of that drugs. Stopping suddenly can cause sadness, anxiety, and extreme tiredness. Depressant drugs, second effects. Depressant drugs like heroin slow down your body. They can make you feel relaxed and but confused. Side effects include sleepiness, dizziness, and trouble thinking clearly. Long-term use can cause serious problems like memory loss. And last is hallucinogenic drugs effects. Drugs like LSD and magic mushrooms change how you see and how you feel. This type of drugs may see by people consuming this can see, hear, or feel things that are not present. Some people have bad trips that make them feel panicked or act dangerously. India is signatory to 3 UN conventions related to NDPS Act. So first is the UN Single Convention on Narcotic Drugs 1961. Second, the UN Convention on Psychotropic Substance 1971 and UN Convention on Illicit Drug Trafficking 1988. These conventions aim to restrict use of these substances, prevent their abuse. The NDPS Act applies throughout the India to Indian citizens living abroad, individuals on ships and aircrafts registered in India. Prior to the enactment of the NDPS Act 1985, India has several laws governing the rules relating to drugs. The Opium Act 1857, the the Dangerous Drugs Act 1980, and the Drugs and Cosmetics Act 1940. The Narcotic Drugs and Psychotropic Substance Act 1985 was enacted on 1985 to fulfill India's obligation to UN conventions on narcotic and psychotropic substance. It consolidated the legal framework for drug control, introducing stricter penalties and enforcement measures. The NDPS Act repealed the earlier Opium Act and the Dangerous Drugs Act, providing a comprehensive legislation. The Narcotic Drugs and Psychotropic Substance, which came into effect from 14th November 1985, makes an express provisions for constituting a central authority for the purpose of exercising the powers of and functions of central government under this act. In presence of this provision, thus the government of India constituted the NCB, National Control Bureau, on 17th March 1986. The Bureau, subject to the supervision and control of central government, is to exercise the powers and functions of the central government for taking the measures with respect to coordinate of actions with various officers, state governments, implementation of obligations to countermeasure against the illegal drugs, and providing assistance to foreign authorities and international organizations to promote coordination and global efforts in preventing and combating illicit drug trafficking. The NDPS Act has been amended 4 times. First in 1988, second in 2001, third 2014, and the latest one, NDPS Amendment Ordinance Act 2021, to address the various issues and improve the effectiveness for the law. Objectives of this NDPS Act: first, prohibition and control of narcotic drugs, to prohibit the production, manufacture, possession, sale, purchase, import, export, consumption of narcotic drugs and psychotropic substances, except for medical purpose. Prevention of drug abuse, to prevent and reduce the incidence of drug abuse through strict legal measures and regulations. The Act aims to deterrent effect by imposing penalties on drug related offences. Forfeiture of property. The Act allows for the seizure of property that comes from or is used in illegal drug trafficking. This objective aims to dismantle the financial networks of traffickers. Establishment of authorities, to constitute authorities and institutions like NCB, Narcotics Control Bureau. International cooperation, to promote the cooperation with the international issues, agencies and other countries in the fight against the drug trafficking, such as UN Single Convention on Narcotic Drugs, UN Convention on Psychotropic Substance, and UN Convention on Illicit Drugs. Treatment and rehabilitation, to promote the treatment, rehabilitation and social reintegration of drug addicts. And last one, research and development. The Act encourages research and development in preventing, treating and controlling drug abuse. Initiatives by NGOs in India regarding drug awareness. So first one is Nasha Mukt Bharat Abhiyan. This was launched by the Ministry of Social Justice and Empowerment, Government of India. It is a drug-free India campaign, aims to reduce the demand of drugs and create drug-free societies. It covers the education institutions more than 3,78,977, and the persons treated and rehabilitated from this NGO are more than 27,75,807. The key features of these NGOs are, the initiative involves awareness campaigns through workshops, seminars, and public outreach. They are often conducted in schools, colleges for the youths. Rehabilitation support. NGOs plays a significant role in providing rehabilitation services to drug addicts, introducing counseling treatment and aftercare support. Capacity building. Training program for government officials, NGOs and volunteers to equip them with skills to handle drug related issues effectively. The impact of these NGOs are that the initiative has been in raising awareness about drug abuse and has facilitated the rehabilitation of many individuals, helping them reintegrate into society. The second NGO is SPYM, Society for Promotion of Youth and Masses. SPYM is an NGO dedicated to addressing issues relating to drug abuse, particularly among the youth communities in India. SPYM educates the youth about the dangers of addiction through multimedia, social media techniques that deliver the message in a simple yet engaging manner. People rehabilitated from this NGO are 5,000. There are drug de-addiction cum rehabilitation for children, for female drug dependents, for adults and homeless drug users. SPYM has successfully rehabilitated many individuals, providing them with the necessary tools and support to lead the drug-free lives in reintegrate society. The third NGO, the Art of Living Foundation. It was founded by Sri Ravi Shankar. The Art of Living Foundation is a non-profit organization, works globally including in India to promote health and well-being through various programs including drug de-addiction. The foundation conducts specialized workshops and programs that use combination of yoga and meditation and breathing techniques to help the individuals overcome addiction. The Art of Living Foundation often collaborates with the government agencies to extend the reach of de-addiction programs. And the fourth NGO is TT Ranganathan Clinical Research Foundation, also known as TTK Hospital. This foundation is a leading organization in field of drug de-addiction and rehabilitation in India. It focuses on treatment and rehabilitation of individuals suffering from substance abuse disorders. So, so the question is, what does these programs focus on? The programs on drugs and alcohol addiction are conducted among school, colleges, and industries with the aim towards minimizing the abuse of drugs and alcohol. TTK collaborates with medical teams of various hospitals, counselors, social workers, NGOs to sensitizing and training them to identify to deal with the drug abusers. So now let's see role of NGOs and civil society in drug awareness. So the first role is education and awareness campaigns. NGOs conduct public awareness campaigns to educate the communities about the dangers of drug abuse. These campaigns used various media and social media workshops, seminars, and community events. Then second is support and rehabilitation services. Establishing and managing rehabilitation centers that provide medical treatment, psychological counseling, and support for reintegration into society, and aftercare programs. And then collaboration with government and law enforcement. Collaborating with government agencies and law enforcement to ensure a coordinated approach to drug prevention and control, and provide training to law enforcement officers as stakeholders on best practices in handling drug related issues. The fourth one is legal aid and support. Offering legal support and representation for individuals affected by drug abuse or involved in drug related offenses, ensuring they receive fair treatment, and educating individuals related to NDPS Act about their rights. The fifth one is advocacy and policy influence. Working with policy makers to strengthen the law and policies related to drug control and prevention, ensuring they are comprehensive and effective, and conducting research to gather data on drug use patterns, the effectiveness of interventions and areas needing policy attention. Sixth, free medicines and treatment. Many people who are addicted to drugs do not have enough money to pay for treatment and medicines. They often pay all their money in drugs. NGOs and society should step in and make arrangements to provide free arrangements and treatment to these individuals. And the last one, meditation and yoga. Meditation and yoga are excellent ways to redirect our energy and focus away from the drugs. They can help individuals find a healthier and more positive path. International Day Against Drug Abuse and Illicit Trafficking, NCB, Narcotics Control Bureau, observes International Day Against Drug Abuse and Illicit Trafficking. The Narcotics Control Bureau, being a nodal agency for drug law enforcement in India, observed the International Day with drug abuse against drug abuse and illicit trafficking on 26 June, with many programs, activities to raise awareness among the public about the harmful effects of drugs abuse in society. Apart from the above, NCB has also organizing following program all over the country through its field units to spread drug awareness among the masses. Organization of seminars, workshops, films, shows on drug abuse prevention at different schools and colleges for the students. Distribution of backdrop flags, banners, posters, pamphlets and publicity through hoardings. Organization of pledges, oath ceremonies against drug abuse and awareness campaigns by coordinating with schools, colleges, NGOs, etc. Holding of runs, rallies, padyatras, street plays against drug abuse. The role of NGOs and civil society in drug awareness and prevention under NDPS Act is crucial and multifaceted. These organizations serve as essential partners in the fight against drug abuse. NGOs often operate at the grassroots level, making them uniquely positioned to intervene to the local communities regarding drug abuse. Despite their impactful contribution, NGOs and civil society face challenges such as limited funding, bureaucratic hurdles, and they need for greater collaboration with government agencies. To overcome this, cooperation between public and private sectors is essential. By working together, NGOs, civil society and government strengthen drug prevention efforts, moving toward a healthier drugs-free society.
Pratham, thank you very much. It was nice listening to you. It was a nice overview of the entire NDPS Act. In fact, you had given nice data also as to what those NGOs have done. So, thank you very much. And this is a small memento from Hammurabi to you.
Thank you, sir.